So our next session is on risk communication by Tim Trevan, the gentleman who knows Saddam's secrets. Let's welcome Tim Trevan. All right.
So we're going to start off this session with getting some answers from you and from your own experience through the COVID pandemic to try and tease out some lessons for communication and how we can do public communication better. And while Ian's pulling up my slides, just want to add a little bit to that last discussion. Magid, you said that there's an issue of trust with the COVID vaccinations. And I think that's one example of where, despite their efforts, the drug companies failed in their communication, because that perception that they were trying to make money out of the pandemic when AstraZeneca was making zero profit and had made all their IP available publicly on the vaccine, shows how, even when they're doing the right things, corporations can fail in communicating that they are actually doing the right things. I guess with Pfizer, it was a slightly different situation, but it does show how, even when we try to get the right communication about the right decisions, we can still lose trust. So, next slide, please. Oops. The question slide's not there. Okay, let's just keep on the title page for the moment then. Let's go back to the beginning. I think I must, don't worry about it, just go to the front page. So the first question I asked you to consider in the question list was taking ourselves back to when we first heard about COVID, or even better, when the first case of COVID happened in our country. How did you personally feel? What was your emotional state when you heard that COVID came to Egypt or Tunisia, Mali, Niger, Algeria? What was your feeling when you heard about it?
For me, indeed, I first heard about the COVID-19 when it was in China. So at this time, I am not fear at all. I just be curious about these new infectious diseases and the highlights for these in China. And I 100% know that if the China announced there is problem, be certain that there is very big problem. So I am just curious about this.
You are curious. Anyone else? And please, anyone online, if you want to answer a question, put your hand up.
When I heard that there are cases in Tunisia, I was not afraid at all, but I was curious about all things around the virus, mainly the route of transmissions, the symptoms, and I have the most important thing that I felt responsible or accountable for my population, because as I am epidemiologist, I have to be prepared to participate in the crisis managers and to help my population to prevent and to control the epidemic.
Thank you.
I just was returned from UCE when I heard about COVID, but I considered it is my duty as a virologist and specified in Corona family. I feel I must do a thing. I must learn community how to deal with Corona, what is Corona, and I go to understand the people, the rule of vaccine. It is not a bad precaution, but must you do. I feel curious, but I feel I must do anything. I must participate in protection and prevention. Thank you.
Right.
Okay, from my own experience, the first case in Niger, I think came late. So you have seen what happened in other countries. So at this time when you have the first case, my thinking is that are we going to lose our freedom of movement, all this restriction? And I have planned to travel somewhere. So will I be able to travel? That was my question for me.
So can I just dig down into that emotion? Were you feeling anxious, or were you feeling helpless, or were you feeling both?
I think first we are anxious because we don't know, if you look at the situation, we see what is happening in the developed country, in our country, how it's going to be. That's the first question. And later, you are fearing if there's this quarantine, you cannot move, you cannot go out. You don't have all this possibility to go buy, say, store, as we are seeing in other countries. We don't have all this facility. So we are just, how is it going to be? That's the question. Yeah.
We have some responses online. James Sakwa is saying he was nervous, but knew duty calls again. Samira says she's a microbiologist and a virologist, and she was afraid because it was an airborne transmission virus.
Right. Anyone else want to?
When I first heard about COVID-19, I was so scared because it was a whole new virus. We didn't know if we're going to survive, what was going, and what would happen to the world then.
So if there isn't anyone else online or in classroom, please go ahead.
For first, my feeling is the bioterrorism, because if someone do a modification genetic in the lab, after the virus HAP in the lab, we can do something for this.
Yeah. So this sort of reflects some of my feelings I went through. When I first heard about it was very early on, and it was when it was still just in China. And like you, I was curious. I was not yet convinced it was going to become a pandemic, but by a mixture of what was coming out of the country and the secrecy in China, I felt that it was probably going to be bad. And so, like yourself, Dr. Ali, and others, I also felt that sense of curiosity about having to learn about it, much about the disease as possible as quickly, and that sense of duty that we should be the front line. So those curiosity and sense of duty were definitely emotions. But I must admit that there was probably some arrogance behind my thinking as well. That I probably thought the US and the UK were better prepared and wouldn't be as adversely affected. So my emotions did change when it dawned upon me just how awful this was going to be and how many people everywhere were going to die. And then fear did come in. Even though I had at that stage armed myself with some knowledge, fear did come in. And particularly for my wife, she's an anesthesiologist, she works in operating rooms in hospitals. I knew that people providing healthcare were going to be amongst the most vulnerable people in the population, so I had fear for my family as well. So let's move on now and consider the question, what did your family members want you to tell them about this? So, sorry, I skipped over a question. What is it you wanted to know? You've already said routes of transmission. One of the things I wanted to know is, are fomites infectious, and if so, for how long? So routes, what else did people want to know?
I want to firstly know the rate of fatality and the mortality and infectivity of these virus to deal with.
So you wanted to know the R0 number, infectivity.
Yes.
You wanted to know symptoms, mortality, morbidity rates. What else did people want to know? Could you pass the microphone?
For my case, I want to know transmission and causes, and mainly preventive and curative treatment.
So, yep.
Yes, for me, plus this, I would like to know the pathogenicity and the incubation period of the virus, and also or the infection, and also the countermeasure. Is it a vaccine available, or I mean, in the very beginning, is it a vaccine or drug available or not? And if not, is there alternative drugs can be effective or not?
So are there prophylaxis or are there treatments? So we're getting at everything, and you're saying incubation period. One of the things I wanted to know was when does infectiousness start? How long does it last? I wanted to know, for example, what the infectious dose was. So how many virions did you need to be infected with to progress to the disease? Anyone online with any answers that we... Oh, sorry.
For me, I have another question because you have quoted about the symptom. You have COVID symptom, cough, and all of that thing. But also you have, normal influenza that people, have, that we know. So at this time, my question was, how can you differentiate normal influenza than to COVID?
So the differential diagnosis between COVID and other fevers and whatever else. And that, I remember that being a big problem with Ebola as well. How do you have a differential diagnosis between, say, HIV or malaria or Ebola? So getting a differential diagnosis agreed upon at the global stage early on, so that we, the responders, know how to make that differential diagnosis. Anyone online want to say anything? Please, those who are participating online, please do participate in this.
This is a communication problem.
Well, let's just, as you've raised that, let's get to this. So there are different ways we can communicate. We can do what we're doing, which is in person. That is the richest form of communication, because you're not just hearing my words, you're seeing me. You're seeing all of my body language. You're seeing my presence even. You know, how am I standing? What's the aura I'm giving off? I'm giving you all sorts of clues as to what I'm meaning and how I'm feeling towards you that do not come across in the words, but they come across visually. That's the richest form of communication. Next richest would be video, where you're not in the same room, but you can see the other person. Then telephone, where you can hear the voice. And then we get down to things like written letters, where we have time to write considered language with nuance and everything. And then we go down to emails, where we're a little more concise. Then we go down to Twitter. Now, generally speaking, the more complicated the issue that you're trying to get across, or the more emotional content the communication has, the richer the form of communication you want to try and use. So if I need to talk to a colleague about their performance, I should never do it by email. You want to have that face-to-face meeting, because that is the richest form of communication. And you know that that's going to be an emotionally charged discussion. So where emotions are involved, you really want to be that face-to-face meeting. Anyway, that's something about communication which is not in the presentation, but thanks for raising that. So let's just come back to that issue of why we had those feelings and why, of curiosity, and of why we wanted to know these things. What do you think was your emotional need that you were trying to address by having that curiosity and wanting those answers?
I think this depends on our culture or our background. Because we are scientists, or it seems to be like this, we are the curious is one of the talent of the scientists. So I think this is normal talent or normal behavior for the people who spend most of their life in the research and reading and something like that. So I think for me at least this is the case. Yes.
Okay, I'm going to not let you off so easily. What do you think you said because we're scientists?
Yeah.
What is something which drives us to become a scientist? Why do we?
Because I love the knowledge. For me, the very happiest time is when I know something new. This is for me.
And I'm exactly the same, and I'm going to push you just a little bit further.
Again.
What do you think drives that happiness at knowing things?
Oh. We are diving, you know.
We're trying to get deep down here.
Maybe let me feel confident, more confident. And because maybe in my background, I know that the knowledge is powerful. So when I get the knowledge, I acquire this power and make me more confident.
Okay.
No more.
Excellent. You've got one part there. I'm going to ask you one more, and then we'll go to the other two. So you said powerful.
Yeah.
What emotional need does having power meet?
Really difficult. I don't know.
You mentioned anxiety and helplessness. Having knowledge helps us address anxiety and helplessness. Please, if we can go there and then.
So for my case, I was curious because there are a lot of unknowns and uncertainty around the virus, around the routes of transmission. And when there is a lot of unknown, we are anxious, we can evaluate or assess the risk, and we put the risk at the high level. When all is unknown at the beginning, there are a lot of unknown around the virus, the origins, the transmissions, the symptoms. Each day we discover another symptom, and I think that being curious and searching information, scientific evidence could satisfy this certain of curiosity and help us to be more confident and trust in our position and our ability to manage the crisis and to help others.
Yeah, human beings hate uncertainty.
Yeah.
And so that's what drives curiosity. Please, Majid.
Because I just was returning from a course about outbreaks, and during the course we deal with how to interact or what I must do during outbreaks, and we learning about influenza, Spanish influenza, outbreak of Spanish influenza. So I was so curious, how can we deal with this outbreak in our life? Second cause, I learned, avoid to be shocked, to know how to work or deal with. So I curious to how to prevention, how to support people, not afraid, must be do everything. All over the world, all of us under the problem. You must do to deal with problem. Not shocked, not afraid, not go away. You must do.
You must do. Yeah. And that drives to another aspect of the same thing. We don't like uncertainty because when there's uncertainty and we don't know how to react, we lose agency. We lose our ability to make decisions. That is taken away from us. And so we want to be able to do. We want to be able to make the decisions to do. And that's what's driving our curiosity. So let's move to that question about the first thing your family asked you. When you got home and COVID was in the news and people started talking about it, what did your family members ask you in terms of advice, or what information did they want to know?
At the beginning, the question is that is it serious or not? Because this is another issue regarding the trust between the public and the government. This is one. So is this serious or not? And if this is serious, is it fatal and dangerous or not? And third, how can we protect us from this disease?
Thank you. That's great.
This is cooperation.
So we talked about trust as being communication.
Yes. So
absolutely, trust is communication, but even more than communication, trust is actions.
Yes.
And people will judge you by what they will. If they trust you, they'll trust what you say. But until they trust you, they judge you by what you do. So please go ahead.
My family, the first question, if they're right, how we can avoid infection, how to save our child. As my wife is a doctor, she was so afraid for my daughter and my son, and she knows that I am know about Corona, so is so afraid, so nervous. How afraid? How we can avoid? How we can get away for that? How you can protect? Is the vaccines ready? That's the first question, and then this distributor for my neighboring and my colleague, the hysteric problem.
The same problem. They want to know how to protect.
Thank you. My family first asked me about preventive treatment or some products or anything that can boost human immunity. They want to be to feel protected and safe maybe at the beginning, and because they trust their doctor in the family, or questions and things are on my head to give them answers, and I was all the time on PubMed looking for new researches and evidence from other countries.
Yeah, that's exactly my experience too. Please go ahead.
For me, the family ask if they have the height risk to contract the virus between me, because I work in the healthcare center and do the diagnostic of COVID. If the risk is very high to transmit in the family the virus.
Yeah. So what's the risk of it getting infected? Did you have something?
Another thing, during this period, there are a lot of, if you can call it, fake news on social media. So most of the time, my family member, when they hear a video on WhatsApp or something like this, they will come and ask me, something, they say that you can drink this stuff to protect yourself. Is it true? Or something like this. So that's mostly the question, my family were asking me at this time.
Yeah. Yes. And we saw that same sort of thing in a slightly different context in Nigeria in the Ebola outbreak. People would go to sources they trust. So if they had a doctor in the family or someone like us in the family, they would go to them. But if they didn't, they would go to other sources, maybe the church that they went to or the mosque they went to, and they'd seek advice from the church or the mosque. But they go to those sources they trusted for the information. Please go ahead.
For me, my family member were too curious about how did this virus. My family member were too curious about how COVID-19 was transmitted. For first one, and about origin, they wanted to know how did this virus suddenly appear.
Yeah. So yeah. Addressing the origins and why we're faced with this. Ian, do you want to go ahead?
I just want to read the comments online. James says that they were all asking if we shall survive, and they kept verifying whatever they read.
Yeah. So a very fundamental question based on fear. Are we going to survive? How do we protect ourselves? What sources can I trust? These are basic questions that our family and our work colleagues are going to ask. So let's just go to the last question now. What in your scientific community, with your work colleagues, what things were you looking to the public health sector, including the private sector, the pharmaceutical sector, vaccine production, research into vaccine production? And let's think of the time before BioNTech announced that they had the vaccine. What were you expecting public health authorities to do and to announce to the public? What were you expecting? As we've all said, trust is absolutely key to this. We, as scientists, we start with a certain amount of trust. As doctors, you have a certain amount of trust. We can only keep the trust if we always tell the truth. We will only keep the trust if we show ourselves to be competent. We've got to manage expectations. The last intervention from the online participant showed expectations which were too ridiculously high, that there would be an immediate vaccine which would completely wipe out the virus. So you've got to manage those expectations. You've got to provide hope and assurance, but at the same time, not promise what you can't deliver. You've got to admit mistakes when they happen, but explain why those mistakes happen, to show that it's not through incompetence, it's just because the situation's complex and we don't know the answers yet. So admit mistakes, but explain why the mistakes happened. Simplify the message so the public can understand, but don't oversimplify. Don't say this is going to be solved easily if it's not going to be solved easily. And then update the public regularly. The then governor of New York had daily briefings with his entire public health team. And much of America tuned into his personal briefings, because although he was just talking about the situation in New York State, he was providing information that everyone wanted to know. So regular briefings, so that once you've taken that information space, you keep it and you fill it, so there's no room for alternative sources to come and give wrong messages. Now, the reason I focus so much on emotions, the emotions behind your reactions and those of your family and colleagues, is that emotions are what drive us to do things. And emotions are what give us that sense of risk. There are 13 well-known factors which make it difficult for us or cause us to either overestimate or underestimate the risk we face. So trust is the first one. If we trust a source and they say the risk is low, we'll believe it's low even if it's not. Whereas if we distrust the source, we're always going to overestimate the risk that they're telling us about. Risk versus benefit. If Monsanto gets all the profits from making GMO crops, but the public bears all the risks of eating those crops, then people are going to overestimate the risk of GMO, because the benefits are not going to the same place as the risks. Control. This goes to the issue of why we have curiosity and why we hate uncertainty. We want to have control of our situation. If we feel we have control, like driving or smoking, we underestimate the risks. If we don't feel we have control, like terrorism or a new disease that we know nothing about, then we overestimate the risk. Choice. If you have a choice about something, again, think of smoking or drinking alcohol, taking recreational drugs, we underestimate the risk because it's our choice. If we have something forced upon us, then we overestimate the risks. Natural versus man-made. We fear man-made disasters more than natural disasters. So this probably goes a little bit to your question about the origins. Is this something natural or is this man-made? So if it's man-made, we're going to overestimate the risk. Uncertainty. If I know there's a 90% chance that something's going to happen to me, I'm going to underestimate that risk because I can factor it in logically into my mind. If I don't know whether the risk is 1% or 100%, I'm going to overestimate the risk because I don't have the certainty about what my probability is. Catastrophic versus chronic, we always overestimate catastrophic risk and underestimate chronic risk. This is why global warming, it's another reason why global warming is so difficult to get people to take seriously, because it's a chronic risk. It's why things like smoking are not taken as seriously as heart attacks. Can it happen to me? Can I visualize this risk happening to me? If I can't, the young typically can't imagine catastrophic events happening to them. So they tend to underestimate risks, whereas the older people can. We're much more likely to. Is it a new risk or familiar? Again, if it's a familiar risk, we underestimate it. If it's new, we overestimate it. Are children affected? The moment it's a risk that can affect children, we start overestimating the risks. Is it told in story form? This is why you see politicians always bring someone who's had the death. When a politician's trying to get a piece of legislation passed to address an issue, they always find someone who's got a terrible story to tell. And they'll bring that person in front of the camera to tell the story, because that makes us overestimate the risk once we can put a face to the risk. And then finally, fairness. Is everyone in the society bearing the risks fairly? There's a lot. I don't know how Africa responded, but I know in Britain, in response to lockdown, there was quite a noisy debate about how this was unfair on the young, on multiple levels, because the young were not being affected, but they were losing out economically because they couldn't go to work. They were losing out in their education because they couldn't go to school. And they were being given the burden of future taxes because the government was spending money like mad by borrowing money, which they, as the young, would be paying in the years to come. So there was that debate in society as to the fairness of the disease. And so that when things are considered to be unfair, people overestimate the risks. If you're interested in diving deeper into this, here's the reference. How Risky Is It? David Rapeek from 2010. So when we start thinking about our messaging, we have to bear in mind the emotions that people are feeling and those fear factors. What the public typically wants and needs to know is how to protect yourself. What can I and my family members be doing to protect ourselves? What are the modes of transmission? What are the elements of infection prevention and control that we, in our normal daily lives, can implement to give us that sense of control over our own protection? So choices and control coming in there. How can we diagnose it? What are the symptoms? Again, getting rid of uncertainty. If you know what the symptoms are, then you have more knowledge about your current health situation. What to do if a family member or a neighbor gets ill, who to call when someone gets ill, what to do until help arrives, and how to decontaminate your house once the illness is over. So the message needs to address both the emotional concerns and the needs, and this really gets to the heart of what we as public health authorities need to be doing. What is the threat? What do we know about the threat? What do we not know? What are we doing about what we don't know? And what sort of timelines
Yes.
what sort of timelines do we have for answering those questions, finding those unknowns, and giving the answers to those? What is being done right now to mitigate the threat, and why are we doing those things? So if we're going to a public masking policy, why are we doing that? If we're going to social distancing, why are we doing that? If we're going to lockdown, why are we doing that? So that people understand the why of what they're being asked to do. What can the public do to protect themselves, and give them points of contact, give them free telephone lines that they can call when they want information and help. So in crafting the message, first thing you want to do is to find out what the experts think that the public needs to know. Then you want to do what Natalie was talking about this morning. You want to go to the public themselves and find out what the public themselves want to know. She talked about going and talking to 100 people. I don't know if you need to talk to 100 people, but a nice representative sample of people is a good way to find out what people want to know. And once you've found out what they want to know, what they already know, what they don't know, and what they want to know, then you're in a position to start crafting the message. And the message should combine both what the public want to know with what the experts think they should know. Now, the reason why you're doing this, and in your message you don't want to say this is what you have to do, is because what we're trying to do is to motivate the population to have safe behaviors during the pandemic. And that motivation has to be self-motivation. If you want to have very widespread public compliance with your public health policy, you cannot rely on policing. You've got to get your population to want to do it. And the three most essential components of self-motivation are autonomy, mastery, and purpose. The purpose is why we say the why. Why are we asking you to do this? Because they can then understand the purpose. The autonomy is that they get to choose how they do it. So you're not telling them what they have to do. You're giving them the information so that they can make informed choices. And then you're also telling them the how of what they're going to do, so they can have that sense of mastery that they can do it correctly. So your public message really wants to elicit those three things: the sense that they have good health choices to make, that they are able to do what's required, and that they understand the reason and the purpose of what they're doing, the purpose being to protect themselves, their close ones, and their community at large. Oops, gone too far now. Now, there is this thing called cultural cognition. As scientists, we seem to think everyone should be driven solely by facts. That would be lovely, but it's not the case. People we are a storytelling species. We tell ourselves a story about how the world works. That's what I call our internal narration. It's the story of how the world works. And we've created this story from our earliest days, through our lived life, through our family, through our culture, through our national culture, through our experiences. And we tend to formulate views about what dangers are based on our ideal, that story we tell ourselves about what the ideal society is. And we tend to adopt the views on subjects that we don't have time to fully research ourselves. We tend to adopt views on those subjects from people who share our worldview, who share that view of ideal society. This is why you see the Trump supporters in America absolutely believing every word that Donald Trump says, because they believe that he believes in the same things as they do, therefore they must believe what he says. This is a really key point in trying to get across messages, and you can see that in the States, public health messaging went really badly through the pandemic because it became politicized. It became either you believe in what Anthony Fauci is saying, or you believe in what Donald Trump is saying, because of this thing called cultural cognition. So given that we have cultural cognition, we have to understand that we have to use multiple channels to get across the same message. Somehow, and it proved impossible in the United States, but somehow we would have had to have persuaded Donald Trump to get the right message out across on public health messaging for COVID. So you've got to consider how you're going to get your message across through different channels, through different spokespersons, through different champions to each of the different cultural groups within your country or your community. And you've got to engage those champions in each of those channels and get them to propagate the message for you. So you will have your public health spokesman up front, filling the space, saying, this is the situation, but then you'll have that message supported by the champions in each of your channels, reinforcing the message and bringing that level of trust and belief to the message. Another way you can do it is if there are very popular soap opera type shows on radio or television, and incorporate the messaging into the plot lines of those entertainment shows. That has been used very effectively in the past for addressing things like HIV/AIDS. And the last point I'd want to make on this communication thing is that we as scientists are often our own worst enemies, because we do have that absolute faith in facts, and we do want to be able to support everything by facts, and that's not quite the way that the public works. So we as scientists, we form our views and make decisions based on things like counting and measuring the number of cases, the costs, temperatures, pathogen loads, infectivity, R0 numbers, that sort of stuff. So we collect all this objective data, and then we try to come to cost-benefit analysis and look for the optimum solution based on our available options. The public don't really make the decisions that way. They tend to be values and belief-based. I talked about cultural cognition, but also this, if you have strong values or strong religious beliefs, those will factor into how you view situations. And we go back to all of those fear factors. They judge things in terms of fear factors. And ultimately their decision is made not based upon cost-benefit analysis, but on the sense of dread or outrage, which is the route of action which causes them least outrage and least fear. So we as scientists have to understand that emotional element. And when we think about public communication, we really have to first understand what are the emotions driving the public reactions, and then think about how we're going to address those emotions in our messaging. So with that I will stop. Any questions?
Okay, thank you, Tim, for this very good presentation. Actually, this allows us to understand a lot of things about communication. But you have now this new challenge, what is social media, because you have the official communication, and also you have another communication that it's difficult, to to control, to manage. So my question is, what makes people to accept, thing from social media, from somebody they never know, you cannot trace the source, different culture, instead of believing what is official from their own government?
Well, I think you've asked a question which everyone's trying to answer at the moment. And I think a large part of that is cultural cognition. That, and I've become a Twitter junkie since this Ukraine war situation. I go on to Twitter and I immediately can see from the first few words which camp someone belongs in. They're either in the Russian camp or the Ukrainian camp. And it's amazing that even though this is an area I study, and I myself find myself emotionally reacting to messages depending on which camp someone's in. And that affects my ability to accept data coming from someone whose view I don't agree with. Another excellent book on this is called The Catalyst. It's written by a professor at Wharton Business School. I'm blanking on his name at the moment. But he talks about when we are so far apart in our beliefs, if we believe Western media or Russian media, they're so far apart. They aren't even talking about the same facts. They have completely different factual bases for talking. What we do at that point, because is that there is no overlap. It's just a big gap. Like, if you're talking about the end zone of, or the goal in one end of the football field versus the goal in the other end of the football field, and the two teams they only stick around their own goal place. There's no game because the players never interact. And the best games happen when each team goes up and down the entire length of the football pitch. Well, if you've got no overlap, then there's no communication. And worse than that, we don't just communicate, and we aren't just barred from actually getting to agreement. When we're that far apart, what happens is that we start to immediately reject any facts that someone from the other side brings. And we start to character assassinate the person who brings the facts. And you definitely see this in the US, the number of death threats that Fauci's got from people in the Trump side of the House. It shows that, there's no communication anymore. So what, I wish I could remember the guy's name, but Jonah, anyway, whatever Professor Jonah says, is called, sorry. What he says is we've got to, when we're that far apart, we have to find other things in common. We have to stop that discussion and take the discussion somewhere else so that we can find things in common, and then we can start building trust. And once we've got trust in these other areas, then we can come back to the issue. But if you only stay in the one issue, you're so far apart that not only will you not listen, you'll actually fight each other. So, and social media unfortunately exacerbates that process. Stephen.
Well, thank you very much for that wonderful talk. As a scientist, we work with public. How can we bridge the gap between, for us, we believe in cost and benefit analysis, and then the public swayed by dread and outrage? How can we bring that so that we can work together?
So I think it does go back to that issue of understanding both the emotional concern and the science, the need. So you've got the concern on one side and the need on the other. And you've got to find ways of matching what they're feeling as an emotional concern to what your advice is as the scientific response to the need. So I'm not sure I can be any more specific than that, but does that answer your question? Yeah.
Fortunately, politicians use the rage so that they can just sometimes even overtaking science because of the rage. They use that in their advantage.
So, in case you didn't hear it, what Stephen was saying just there is that unfortunately politicians sometimes, understanding that the public responds to dread and outrage, will use that and will inflame the dread and the outrage rather than trying to address it. And that is absolutely true.
Thanks, team, for these excellent presentations. My question is regarding how to address the rejector. Either this rejector is personal or a group. Thank you.
And this is something we see in safety, quite separate from catastrophic responses. You always have the naysayer, the person who is the last person to adopt any new process. The first thing you can do is to see whether there's another voice they will listen to. See if there's someone who will listen to you, but who they will then listen to. The second thing you can do is to see how you can protect yourselves against them in the meantime. What risk do they pose to the rest of society? What actions can you take to protect the rest of society from them? And it may be that in a very serious case, then you have to take some public policy decisions which limit their liberties based on their refusal to comply. And this is not without precedent. We do have quarantine. I don't know what the situation is in Egypt, but certainly in the US and the UK, if a kid wants to go to public school, they have to be vaccinated. If they choose not to be if their parents choose not to get the kids vaccinated, they're not allowed to participate in public schools. So, this idea of removing liberties based on your refusal to comply is something that has a track record. If it's a small scale one, then one of the things you can use is peer pressure. So you're not relying on you directly imposing your will, but you're relying on those closest and nearest to them who have adopted, have been compliant themselves to either persuade or through negative social interactions to persuade them to comply. The medieval church had the worst punishment in medieval Europe was excommunication. And that's because we're social animals. If you are shunned by your peers because you're doing something which is socially unacceptable, that's a very strong incentive to conformity. I'm not saying that should never be a first resort, but there's a stage before that excommunication where people don't like to be isolated, they don't want to be on their own, they don't want to be the only one doing a particular thing. If you manage to persuade a sufficient critical mass of people to do the right thing, most of the time the stragglers will come along eventually.
For rejector, if continuous pushing or killing him with a life example give a result or give a response?
Sorry, could you?
For rejector in rejector person.
Will it always give a response? No.
Continuous pushing or informing him with giving a life example give a result?
Well, if you keep on confronting someone, well, first of all, as I said, the primary objective should be self-motivation. So it's a decision they make themselves for their own benefit, that they want to make, they want to do this. So getting into the enforcement is something we want to leave to the last. The reason why that is because of a thing in psychology called reactance. If I tell you to do something, your first reaction is going to be, I'm not going to do it. And that's going to be your visceral reaction before your brain, before your cognition, your conscious brain kicks in, is going to be no, because you've told me to do it. And that's part of what we're fighting when we start shaming people, because we're ratcheting up the reactance. Once we turn it from a non-emotional instruction, which will generate reactance, and then we put emotion behind it, the shaming, we create more reactance. So if you just continue pushing, the likelihood of getting a change of behavior is low. But if you push to a certain extent and then try a different route, try and understand what is the emotion behind their refusal, and how can you address that emotion, then that might be more successful. Or, as I said, who else can do the persuading? Who is a better person to persuade that person than me? Those are both alternatives. But you're never going to get 100%, that's for sure. When we're dealing with the entire world population, there's no way we're going to get everyone to agree. We just need to get it, the acceptance, the compliance above whatever the R0 is telling us we need to be at to get to herd immunity.
Any other questions, physical or online? All right, let's thank Tim Trevan for facilitating us on risk communication.